Hey guys, welcome and welcome back to my YouTube channel. In case you are clicking into this video or into this channel for the first time, kindly consider clicking the subscription button. Don't forget to like, share, comment, and don't forget also to turn your notification bell so that every time I post a video you will be the first person to be notified. So guys, I want to talk about something that is very important, so stay tuned, watch this video up to the end, and especially it is for men, and it is not only for men. Ladies who are also here should tell their partner or their husband. So I know most of you have been asking, what is the role of the father or your partner during pregnancy? Now we have this book here. If you have ever seen this book, you are lucky, because I know you are a father somewhere, or you have supported someone who is a father in one way or the other. So before I got interrupted, guys, I was saying I know most fathers usually ask that what is our role during pregnancy, during the first 5 years of life of a child, and during a childbirth, and also maybe family planning. So I was talking about this book. This book has stated this role clear, and we are going to go through them one by one as I'm explaining how can you take your part as a father to take care of your woman and your child during pregnancy, during childbirth, that is during when the mother is in labor, and also after childbirth, that is immediately after postpartum period, that is 6 weeks, and after that also during family planning. So stay tuned. This topic is very interesting, and so you should not get bored. So the book is written father support for mother and child. And fathers, you are very important for the health of the mother and the child, as well as your own health. I'm reading straight away from the book. I'm not getting them from somewhere else. Not that I cannot do this content without reading, but I want you to know that this book, if you've ever seen this book somewhere, please take your time and read it, because we have those roles in this book, and they are very well explained. And you know, people just want to be reminded. So today I'm just reminding you and telling you that kama umewahi kutana na hii kitabu na hujai soma your role as a father, then you are missing a lot. You should know your role as a father during pregnancy, during childbirth, and during after birth, and also when you are taking your woman or your wife for family planning. So let's start. So we are going to start during the pregnancy. What is your role as a father? Also, what is your role as a partner to that woman? Number one, show your wife that you care about her and you can help her both physically and emotionally. That is something that is very important. Some people usually just give pregnancy, and then they let their woman or their wife go through that pregnancy alone. It is always hard. Pregnancy is not a cup of tea. If you've ever been pregnant, you can testify in the comment section. If you've ever been pregnant and you went through that pregnancy alone, it is always not easy. Cravings, a lot of morning sickness, and morning sickness, it is not just the way you hear people saying it. It is a morning sickness. That thing can fuck you the whole day, the whole night, the whole week, the whole month, even 3 months, 4 months. You can be bedridden because of morning sickness. So it is not always a cup of tea. So show your wife that you support her physically, emotionally, financially. Yeah. That is number one. Number two, ensure your wife or your partner has support for the house chores. People usually think that, sometimes you are the breadwinner in that house, yeah? You are the breadwinner. Your family depends fully on you, whichever. Your family depends on you fully. And if you don't go to work, maybe they won't get the basic needs. So, when your wife is pregnant, you just find someone who can help that woman to do house chores. This is not a must that you stay there, start washing the dishes, start washing the clothes, start mopping the house. You find someone, even if it is not someone that stay permanently in the house during that period, but you find someone who can help her do some of the house chores, because things like bending down to wash the clothes, it is always not advisable when you are pregnant, because it will cause pain. The mother will suffer from back pain. So get someone if you are not available in the house. Of course, I know most of men don't usually stay in the house most of the time. So get someone to help your wife do the house chores. You can't do it alone. So just get someone and help her do the house chores, especially things that need her to bend. Things that need her to bend. That is the time she should avoid all those all those activities that need her to bend. Number three, ensure your wife and partner, or your wife or partner, eat healthy food, and at least 5 out of those food should be balanced diet. Ensure your wife get 3 meals, and in between these 3 meals, your wife has gotten snacks in between and a lot of clean water. Yes, ensure the food is in the house, and your wife is can eat this food. Ensure that your wife get the 3 main meals: the breakfast, lunch, and supper. And in between these 3 meals, your wife has maybe eaten fruits, your wife has maybe eaten snacks, your wife has drank a lot of water, because during the pregnancy you will need the fetus will need the nutrients, and you know that nutrients are gotten from the food. Yeah, the nutrients are gotten from the food. And if she doesn't get the balanced diet, where will she get these nutrients? And some of these nutrients they help in making the iron and folic acid, which are very important when the baby is still growing and when the baby is still young, for the development of the brain and the spinal cord of the baby, and also for the blood to build up in the body to help the baby grow healthy, well, and whatever. So ensure your wife get enough food in the house, and ensure your wife has clean water so that she can drink each and every time she wants. The next point, accompany your wife to the health facility as much as possible. As much as possible. And most hospital has made it easy. If you come with your wife, you will be given the first priority. So ensure you take your wife, or you accompany your wife to the health facility to go and see the healthcare provider. And also it will make work easier for her. If you go to the hospital alone, if a woman goes to the hospital alone, you will get when there are so many people, and they will not give her the first priority. So she will stay there the whole day, waiting to be attended to. And remember, when you are pregnant, mostly the first trimester, and even not mostly, pregnancy has so many challenges. You go there, you get nausea, you get vomiting, you get dizziness, you get sick, and no one is even attending to you, you know. Now it is not good. So ensure that you accompany your wife to the health facility so that you be attended to so fast, and then you can go back to other activities, so that also those activities will help you take care of your wife. Yeah. The next point, get tested and treated for STI and HIV in case you have. Yes, get tested. I'm not the one saying this thing. This book has stated it clear. Get tested and treated for sexual transmitted infection plus HIV. If found positive, you will receive appropriate advice on how to protect your unborn and your your born baby, on how to protect your unborn baby, and also how you will start your treatment. Yes. So of course we know that during this period sometimes a sexual drive for the women usually goes down, and this is the time some women will start jumping from one woman to the other. And remember, you are putting your wife at risk of getting sexually transmitted infection and HIV, and also you are putting your unborn baby at risk of getting sexual transmitted infection plus HIV. Remember, when your wife gets syphilis, the baby will be born with syphilis. When your wife gets when you walk upside and down, you get HIV, and you transmit this HIV to your baby will be at risk. Of course, nowadays children are born children who their parents are positive can be protected, and they don't become positive. But that does not mean that you walk to every woman so that you get HIV and AIDS. Remember, if you don't get HIV and AIDS, gonorrhea is there. You might give birth to a blind child. Yes, you might give birth to a blind child. Gonorrhea causes blindness in children. So you might give birth to a blind child without knowing, because you refused to abstain, you refused to be responsible during this period when your wife was pregnant. And remember, this wife was carrying a whole human being. The wife is carrying a whole human being. Sometimes some of the activities they can't do. Sexual drive is low. Everything is boring. Food is boring. Everything, even your presence is boring. So you just put up with her and take care of her. Yeah. The next point, ensure that your wife have a birth plan. What are birth plan? You see, this book is very nice because we also have those birth plan here. Okay, if you want to know a birth plan is it is a tool that preparing for a safe and healthy child birth. Yeah, it is just how you plan how the child will be born. So ensure your wife has a birth plan, and this birth plan contain expected date of delivery. Of course, when you go to the health facility for antenatal clinic, you usually the nurse knows how to calculate the expected date of delivery, and also if it is impossible, you can be sent for an ultrasound so that ultrasound can reveal your expected date of delivery. So this birth plan contains expected date of delivery, and also this birth also contain the health facility with the name where you will take your child. You will take your wife to that hospital when the time of delivery comes. And also this birth plan contains someone who will attend to your wife during delivery. Is it a nurse? Is it a midwife? Is it a doctor? Is it gynecologist? This birth plan has those things, so that in case of emergency they know where to start from and what to do. This birth plan has the phone number or the phone number of the health facility your wife will deliver. In case your wife started labor without knowing, or if in case there is emergency, someone who is next to her, who is near, can take the phone number, call the ambulance come, take the wife to the hospital, and then emergency will not become emergency again. And also this birth plan has the next of kin or birth companion, and this birth plan ensure that you have kept the transport that will take your wife to the health facility. You know the donor in case of emergency. You know, if you go to delivery, whether vaginal delivery or whether CS, something might happen and they might need blood. So you have to know who will donate blood during that time. So, and the last one, this birth plan has a financial plan for the child. Immediately you realize that you are pregnant. I know the fathers are trying to understand. We are pregnant. Yes, you are pregnant, you and your wife. Immediately you realize that you're pregnant. Start saving small amount of money, so that by the time that your wife is giving birth, everything is in plan. The baby has the clothes, the baby has the blanket, the baby has all the basic needs that he or she will need when your wife when she comes to the world. So you ensure you have a birth plan for the baby from the time your wife did what? Became pregnant, and to the time she gave birth, up to, maybe if you can do it up to 5 years, that is better, or if you can do it up to it depends on you. But the most important time is the time she got pregnant up to the time she delivered, so that every time everything is in place, so that she doesn't suffer looking for one and two things after she has given birth. Another point is that ensures, as a father, you play and communicate with your unborn baby during pregnancy. Some of you doesn't even care. Your wife is pregnant, your wife is struggling to breathe. You just think that pregnancy is not a cup of tea. It is not a cup of tea. It can make you not to eat. It can make you not to breathe. You're struggling to breathe, and even you can't touch the belly of your wife. Talk to the child. Maybe she can he or she can listen to what you are saying, and maybe all this drama that are being caused by their can cool down. So ensure you communicate and play with your unborn baby during pregnancy. It is important. In fact, it starts creating the bond too early, and the baby will come out knowing your voice even before they are born. If some people, some unborn baby, they usually, not all of them must, or they usually know that this one is my dad, this one is my mom, this one is my sister, especially if you talk to them each and every time when they are still in the womb. And the last one, your role during this pregnancy is discuss with your mother or the wife the type of family planning she will need after she has given birth. This family planning should not be should not be only favoring her, but it should be a family planning that both of you agree about, and it should be something that favor both of you. So discuss with her the type of family planning you will use after she deliver the baby. Now, let us look at the role of the father during childbirth. During labor, yes, during labor. In Kenya, this thing, there's some hospital they don't agree with it, but it is wrong. It is wrong because it is allowed and it should happen. Especially in most public hospitals, they don't provide the things that I want to talk about. But if you know the hospital that you are choosing for your wife does not provide that privilege, kindly you can exchange because it is allowed. So during your childbirth or during labor, ensure availability of basic need in the house to avoid worries as the mother or as your wife goes to the clinic. Maybe you have some other children, or maybe you are staying with some people in the house. Ensure they are well taken care of so that your wife doesn't worry what will the other child eat, how will she go to school, what a lot of things. You know, mothers will like worrying a lot. So ensure you provide the basic need for the people who are remaining in the house or the kids who are remaining in the house, so that you make your wife not to worry as she goes to the labor. Number 2, ensure transport for health facility. If you have already had the birth plan, this one is something that is, yeah, you've sorted it up. And also ensure you have emergency kit. When now your wife is about 37 weeks, ensure that you have emergency kit. And what are the content of that emergency kit, or what does that emergency kit contain? You must have 2 gloves. Yeah, you must have 2 gloves in that emergency kit. You must have 2 cord clamp. Cord clamp is very cheap. People usually think that some of these things are so expensive. I think even the cord clamp doesn't cost 100 bob. It is less than 100 bob. So ensure you buy 2 cord clamps. Ensure you have a scissor, a new scissor. Ensure you have a new scissor. And another thing that you should have in that emergency kit is maybe a cotton and maybe the basic need for the child. So yeah, those are the things that you should have in that emergency kit, so that maybe if you are taking your wife to the health facility and something happen on the way, someone who is coming to help you is protected from infection, and also your baby also is protected from infection. And another point is that ensure your child ensure other children are taken care of. I've talked about that. The next point, if you stay with her during the labor, you can help her give birth. You can help by giving her emotional and physical support. You have to stay with her. You have to stay with her. Are you listening? You have to stay with her during labor and delivery, and ensure that you give emotional and physical support. Why do you want someone else to do back massage for your wife and you can do that? Why do you want someone to help her with to walk around, to help her to help her with the emotional support, to help her get some of the things? Maybe if you are not around, get someone to do that for her. But if you are around, ensure you take your wife to the delivery room. Yes, ensure you take your wife to the delivery room and give emotional and physical support to your wife. And then the second last point, build her confidence by encouraging her, by telling her she's doing well. When she is pushing, you can encourage her, you're doing well, you're almost there. Yeah, you just encourage her so that she feels better. Eh? If you've ever given birth, you know how that bed is terrible. So ensure you are there, you give her support, you give her whatever, you give her emotional support, you encourage her, you help her with everything that she needs during that time. I help her walk around, squat during construction, do the back massage, and those are the things that you need to do during childbirth and labor. So after childbirth, now the baby is here with you. What are you supposed to do as a father? What are you supposed to do? The first 6 weeks after birth are the most important for both mother and the baby. This is the time you should bond with the child, with the newborn, and also it is the most important time for the mother and the baby. The mother is so exhausted, and this is the time she needs a lot of sleep. And remember, this time the baby is also let me say stubborn. Yeah, so you should help her with all you carry for her the baby so that she get enough sleep. Huh? And ensure everything is in the house so that she gets enough sleep, and also she get enough rest. Yeah, another point, ensure the baby is given only breast milk for the first 6 months. Yes, you should ensure that the baby is given only the breast milk for the first 6 months, but that is not possible for people who are working, because after 3 months you will be needed to go back to work, and you will replace breast milk with formula. But I want to say that some hospital, like us nurses, when you get pregnant and you take maternity leave for 3 months, they usually give you another, some hospital, I'm saying some hospital, they usually give you another 1 month for leave, your annual leave, and also they will also add you some of the public holiday that you did not go. So you get that by the time you are you're going back to the hospital, the baby is already almost 6 months, or maybe 6 months. It depends with your holidays, and also it depends with the hospital. So to us nurses who are working in those hospitals who consider those factors, at least we are safe, because our child will get breast milk up to maybe 6 months. To those who cannot afford that, or the companies or where they're working cannot give them that privilege, I'm sorry, but after 3 months, find a way of doing what? Of making your baby comfortable, so that your baby doesn't go back to malnourished, or your baby don't get malnourished. Another point, take time to hold and care your baby to establish cleanliness, bonding with the new child. This will also give your wife a chance to sleep and rest. I've already talked about that. If the mother is HIV positive, the baby should get prophylaxis, that is nevirapine and zidovudine. They know. They will be guided on how they should take those drugs, and also how the baby should be given those drugs, and they will be guided also how to take care of the baby. Help the mother to rest more by doing some of the house chores, or getting someone else to do them. I said that it is not a must that you are the one to perform all those house chores. You can find someone to help your wife do all those house chores, because it is also hard, because you are working outside, and then when you come back, everything is on a standby. You will get also exhausted, and you will find it stressful. You will start getting stressed instead of taking care of your child. So find someone to help her. If you cannot afford, you can talk to one of your relatives who is doing nothing at home to come and help you stay with your wife for quite some period of time. And some men, you have bad manners. You bring one of your relatives in the house to take care of your wife, and then you end up sleeping with that. That is bad manners. Sometimes just reason up and be mature enough to consider some of the things. In fact, it does what? It interfere with the relationship we have with the family of that person. You see, it is not a good thing. You bring someone to help you with the house chores, you sleep with that person. Some men, you should go to hell. Also, ensure the baby is getting exclusive breastfeeding. I've already talked about that. Be sure to play and communicate with your baby. Some of the men, even they don't care. The woman has given birth. They're just there keeping quiet, watching TV. They can't carry the baby. They can't do anything. They don't talk to the baby. They don't. So you are wondering, are you the father of the baby or that child? You are not creating any bond. You are not creating any relationship with the child. The children will grow up knowing that the father is just ni simba. Babangu ni simba. Yeah, aguziki. Akikohoa unatoroka mbio. That is not good. Communicate with their child, play with their child, ensure you create friendship, you create bond with your child, so that in future, if your child will grow up, your child will get an easy time with communicating some of the things with you without going outside and telling somebody else. Yeah. Also, avoid sexual contact with the bleeding mother, and also avoid sexual contact with the discharge that comes after the birth. Some of you usually think that the woman or the mother of your child that just doesn't want to have sex with you. It is not healthy. It is not healthy at all. And bleeding after delivery sometimes can goes up to 3 months. Yes, it can goes up to 3 months, or it can goes more than that. So avoid sexual contact during this period because it is not healthy. You will cause infection, which will bring the mother to the hospital again, and also it is just not hygienic. Just give the mother the time to heal very well, so that by the time you are assuming these things, the mother is healthy and everything is okay. Yes. Accompany your wife and your partner, or your wife or your partner, to receive postnatal care, and during this postnatal care, it will be the time that she will be taking the baby for immunization. So accompany her. That privilege will also come again. She will be given the first priority. So accompany her to the hospital, because all Kenyan hospitals, they really know when you come with your partner to the hospital, they're supposed to be given the first priority. Yes, they're supposed to be given the first priority. Some hospitals usually ignore, but when the authority will catch up with you, you will not like it. They should be given the first priority, because you know fathers are people who are very busy. Sometimes they are just creating that time to take their wife to the hospital, and then they have to go back to work again, because most of the time you know that they are the people taking care of they take care of everything in the house during that period of time. Everything, I mean financially, whatever. So give someone who has come to the clinic, or someone who has come with the partner to the clinic, the first priority. If you don't, and you're working with me, that will be very wrong of you. And then the last thing, after giving birth, now the family planning comes in. maybe the mother has healed up and now she can reassume sexual activities. Now the family planning will set in. So you have to know that to have healthy mothers and baby, it is best to space your child at least 2 years between pregnancy. These 2 years ensures that the mother is totally healed, and when maybe she gave birth via CS, give at least 3 years, so that at least also the wound is healed completely, and also it will avoid complication or maybe uterine rupture during pregnancy. So give the mother the enough time to do what, to heal, and to give, by giving the mother enough time to heal, it's by having family planning. So discuss with your wife which family planning is best for her, so that you can consider that. So you can help your family be healthy by using family planning. The mother can start appropriate family planning method immediately after childbirth. That is will be upon you when the mother will decide to get the family planning. You know, we have several types of family planning. I've already talked about all these types of family planning, which one is best at what stage. So if you have not watched any of those, please kindly go and watch. I think those are the important things that fathers has to know when the wife became pregnant, or when they became pregnant. You have your role during pregnancy. I've stated them well. You also have your role during childbirth, and also you have your role after childbirth, and also during family planning. So ensure you do the right thing. Pregnancy is not easy. Pregnancy is something that should, I don't know if you have ever been pregnant. You can comment and you tell us your experience, because what I know from my experience, pregnancy is not easy. So you need someone to take care of you. You need someone to give you emotional support. You need someone to accompany you to the hospital. Those small things, they matter a lot. So tell me what you want me to talk about in the next video. Bye, till next time. Let's meet in the next video. Don't forget to subscribe, don't forget to like, share, comment, and don't forget also to turn your notification bell, so that every time I post a video, you will be the first person to be notified. Bye, till next time.